Welcome, everybody. Can everyone hear me well? All right, fantastic. Thank you. All right, so welcome to the Speak Up Symposium featuring WELLMTL and Mindstrong. My name is Ryan. I'm really excited to be here. I'm just going to speak for no more than 5 minutes because we have an amazing keynote speaker here who will do that job. And I just want to introduce things. So I'm not going to share my story tonight because it's online and I've done that so many times now. But I will just say what my story symbolizes. About 3 years ago, I found myself in a year-long depression. The first 6 months of that depression compared to the next 6 months were totally opposite. The first 6 months, I suffered in silence. I shared my story with my parents, but that's it. I didn't let my 2 siblings in. I didn't let any friends in. I kept everything to myself, and I really struggled. I had a lot of tough times. Going through the depression is hard enough as is. Going through it by yourself is even tougher. That was the first 6 months for me, and it was pretty bad. Fast forward to those next 6 months. Finally, through Bell Let's Talk Day, actually, I found the courage to share my own story. And it was totally on a whim. I wrote it at 3 a.m. that night, a bit sleep deprived, but then the next day, I felt confident sharing that story. And I posted it online, and the feedback I received from that story was absolutely amazing. And I realized there's something in sharing your story. There was power in the stories that we have to share. There was power in words. So why did I feel ashamed? Why didn't I let anybody in? And that's what started my road to recovery. I was building myself a support group, letting people in, and feeling more comfortable in myself than I ever have. I used to feel weak for going through a depression. Now I feel that it's giving me strength. With that said, that was 3 years ago. Now I look over here, now I see about 150 people in a room who just have a genuine desire to learn about mental health. It might be for themselves, it might be to support a loved one, or it might be just to gain general knowledge. But to see where we were 3 years ago, we were so ashamed of sharing our stories, or at least I was, to where we are now, it makes it all worth it, and I'm just so proud of that fact. So that's why when WELLMTL and Mindstrong decided we wanted to do something together, we thought this Speak Up Symposium was a perfect idea. Tell you a bit about WELLMTL. This is a company that I created that actually started after the fact. Usually most people brainstorm starting a company and then go out and do it. For me, I created all these programs and I realized I love creating these programs. So I was a part of Stronger Than Stigma movement at the university level, and recently I created an anti-stigma program where I go into high schools and talk about mental health and stigma. And I said, I love creating these programs and they're so needed. These programs are needed in elementary schools, high schools, universities. So then I said, let's create an umbrella organization that can run all these mental health programs. And Mindstrong, I can only hope to get to where Mindstrong currently is. Mindstrong, what they do this, they hold a fundraising fitness event every year. This year it's Sunday, May 6th at the Midtown Sanctuary, honoring Rula and Alan Rossi. And I just wanted to take a second to thank Diane Saucier from Midtown Sanctuary for hosting this event, which raises millions for Mindstrong, which in turn ends up in the JGH hospital. And where that money goes to is that, well, first they raised $3 million, and that's allowed them to hire a youth intake coordinator, expand the youth mental health program, creating an app called Amini for patients to have easier access with their doctor, to renovate and to rebuild the psychiatry inpatient unit, and many more initiatives. And we really hope you can take the time to meet us at that event, May 6th. So when we came together to host this event, we knew we needed a proper keynote speaker, someone to really engage people, someone who can share their story, but more than just sharing their story, really educate about mental health. And we went through a lot of people, and we found the perfect keynote speaker, Jason, who I'm going to introduce in just 30 seconds. But before I do, I just wanted to give a few thank yous, because without some people, this event wouldn't be possible. I need to personally thank, on my behalf, the entire Mindstrong team, because without you guys, this event would not have been possible. I've thrown many events at McGill, but those events compared to right now, this has been the most pleasurable event I've ever planned. So to the entire Mindstrong team, from the bottom of my heart, thank you so much for collaborating with me on this. I have to thank a couple sponsors. Firstly, Brad Steinmetz from BMO Wealth Management. And secondly, I don't know if anybody knows him, I don't, but Fred Golt from Goltie's Toys. Some great sponsors we had to make this event possible. And just one last little tidbit. If anybody has any questions throughout the symposium, please just raise your hand. A volunteer will come to you. and you have a cue card where you can write your questions, and a volunteer will collect the cue card, and we'll take a look at those questions once the event's over. So, with that said, it is my absolute honor to introduce Jason Finucan. Jason is a professional speaker, a consultant, and expert on the stigma surrounding mental illness. Jason founded Stigma Zero in order to help clients reduce the cost of workplace mental illness by directly addressing the barriers created by stigma. Jason shares dramatic personal stories of both physical and mental illness, which helped shape his deep insight into what causes stigma and how we can get rid of it. It is now my pleasure to introduce my friend currently, Jason Finucan.
Thank you so much, Ryan. Mental illness is unfair. It can be devastating, it can tear apart relationships, it can ruin careers, and in the saddest of cases, it can end lives. However, there is an aspect about mental illness that makes all of these things even worse, and far worse than they need to be, and that is stigma. Stigma is the unwanted and unfair complication that comes with mental illnesses, but doesn't come with physical illnesses that we all know, like cancer or heart disease. I came to learn this the hard way over the course of many years as I went through things including a major heart defect leading to open heart surgery, and later in my life, bipolar disorder, and I'll share with you some of those details. But the most important thing I learned was that this extra that comes with mental illness is something we all have the power to change. Who knows the show Three's Company? Who remembers that? Yeah. Well, in grade 4, Three's Company was my favorite show. I came home from school every day and I watched Three's Company. I think in grade 4 I probably didn't understand half the jokes, but I loved it. And one day, there was a bit of a difference. It was kind of a dramatic difference, in fact. So just imagine you've got a 9-year-old boy sitting on the floor, cross-legged, and he's watching TV. And all of a sudden, he jumps and says, "Dad, something's wrong with my heart." And my father, who let me describe very quickly, is the kind of guy who a small thing, a small irritant, a noise or clutter or something you forgot to do, that would set him off. That would drive him really around the bend and he'd get mad. But if something big was happening, he was the calmest person in the room. And when my dad came over with a concerned look on his face because I said, "My heart, something's wrong with my heart," and he felt my chest, my heart was beating 200 beats a minute. Out of nowhere, it had jumped from a resting heart rate to 200 beats a minute. So if you can picture this, think of the last workout you had that elevated your heart rate as high as you could absolutely stand it. It was probably around 170, maybe 180. 200 beats a minute when you're sitting at rest is dramatic and painful and scary. And my father felt my chest and his face went white. He looked terrified, which of course I interpreted as, wow, this is serious. Dad's scared, I guess I should be scared. So that day, I will never forget that moment, but that day was the first in a 4-year journey of discovery. It took a long time to figure out what exactly was wrong with my heart. It kept correcting on the way to the hospital. It became a joke that whenever my heart would race, we'd say, "Well, let's get in the car, go to the hospital." We wouldn't even drive to the hospital. We'd drive around the block because it would stop. And every time we went to the hospital and tried to describe this to them, they had a very difficult time understanding it and figuring out what it might be. Eventually, I finally had a really great doctor who figured out the difference in my ECG versus somebody else's and sent me to Toronto Sick Kids Hospital. So I'm from Ontario, don't hold that against me. But I was in Ontario at the time and I find myself in Toronto at the Sick Kids Hospital, which is incredible. And a doctor tells us the bad news. It's that you have a nerve defect in your heart. It's called Wolff-Parkinson-White syndrome. And the only way to fix it is open heart surgery. So at 12 years old, I had open heart surgery. Now, that is a terrifying thing to go through at 12 years old. You're aware, it was 1988, this was a very serious surgery, and you're aware that things might not go well. There was a 50-50 chance I'd have a pacemaker. There was a slight chance I might not make it. And all of these things were very clear in my mind. But I was lucky. I came out the other side, no pacemaker, a heart that was corrected, and I was able to recover within 6 months. So in the end, as hard as it was, this was a success story. But it was also the beginning of my education about stigma around illnesses. Now that sounds a little strange because there isn't a stigma around heart disease. And you're right, there isn't and there wasn't. Not once during those years I was suffering did anyone in my family, in my friends, or at my schools say to me, geez, you know, have you ever thought of trying harder to just make your heart better? Have you ever thought of maybe just change the way you exercise? No one ever threw out these simple little isms that we do with mental illness, and no one judged me. No one questioned that this was something happening to me, not something that was a character flaw, not something that was my fault. Now, of course, I took all that for granted. I had no idea how lucky I was. I just went through this experience, came out of it, and then returned to health. Now let's fast forward. We're going to fast forward to 2002. So I basically spent from grade 7 until I was 26 enjoying the kind of health that anyone who has great health takes totally for granted. The kind of health where you don't think about your health at all. The kind of health where the most you think about your body and how it's working is when you have a cold or a flu. I loved it. It was awesome. And I honestly had this idea in my mind that, hey, I had my big health challenge when I was a kid. So I get a free ride and I'm just going to be a healthy guy for the rest of my life. And, you know, that was a little naive and it turned out to not be true because I mentioned I'm from Ontario. Well, I moved here in 2001 and I did it to chase a girl. As good a reason as any. And my girlfriend had come to McGill to do her master's and then she wanted to do her PhD and was accepted to McGill and U of T. And I fell in love with Montreal when I was visiting her over that year that we were doing the long distance thing. So I come to Montreal and I say to her, I think you should take McGill because it's what you want, and I'm gonna move. And I just moved. I don't speak French. I didn't have a job. It was looking back, it was a laughably risky thing to do, but it turned out quite well, and I ended up finding a job at McGill University. Good place for an Anglo to work because it was an English working environment. So I was lucky. I found this little pocket that I could work in. It was also a big step in my career. I had been a salesman. I'd been unhappy in my work, really just couldn't find a good fit. And suddenly I was working in fundraising and alumni relations for a university that I respected. And I was working with people I respected. And I loved my job. I loved my girlfriend. And I was actually about to propose. And then in fact I did. So now I'm newly engaged, living in a city I love, working at a job I love. And I wake up one day and I am in the midst of a mild depressive episode. Now, I had no idea that it was a mild depressive episode at that time. I didn't wake up and say, oh, I'm mildly depressed. No, of course not. I woke up and realized I feel from my head to my toe like I have the flu. Everything is lethargic. Everything kind of hurts. Not in an acute way, but dull ache everywhere. My mental acuity was definitely reduced. I didn't feel as sharp or as smart. I certainly wasn't able to communicate verbally the way I normally do. And this was something, when it happened to me, I had no idea what it was, why it was occurring. All I knew was my life was great, and I felt this sort of down feeling. Now, many people describe clinical depression as also including an emotional component, which for many people it does. They feel very sad. They maybe will cry a lot. I happen not to feel that way. What I felt was more like being a zombie or being somehow shut off. That's the way I describe it. Or I have another analogy that helps for some people to understand. It's like walking through the world with a plexiglass box around you. You can see everything. They can see you, but you can't touch anything. You can't really smell anything. You can't really taste anything. So you're walking through the world and everything is muted. Now, I was experiencing this on a spectrum of mild, moderate, severe depression. This was a mild depressive episode, but it lasted from the day it started for 2 months straight, 24/7 for 2 months straight. Now, I was young, naive, unaware about mental illness, so I never once considered this a mental illness, and I kind of just plowed through it. My fiancée was starting to get a little worried, but then it stopped. After 2 months, I woke up one day, and I said to myself, wow, I feel good. Like, really, it's gone. All of those things I just described were gone. And for 3 months, they stayed gone. I felt fantastic for 3 months. Now, if it's difficult to diagnose, self-diagnose, mild depression when you don't know anything about mental illness, I can guarantee you that mild hypomania is extraordinarily hard to describe, to self-diagnose, and to figure out what it is, because all you know is I don't feel depressed anymore. I feel good. But what it turns out was, if I had a baseline, we all have a baseline that we could describe as our normal, and this is an important phrase that I want you all to use. Don't ever say normal, say my normal or your normal, because we're all different. We all have different sleep needs, we all have different energy, and my normal was one thing, and then I had gone below my normal. Well, now I had gone a little bit above. For those of you who don't know what hypomania is, it essentially is mild mania. So mania comes in 3 levels, just like depression: mild, moderate, severe, mild, moderate, and severe. The difference is with hypomania, it's called mild hypomania, moderate hypomania, and then manic or mania. That's the most severe version. So I was bouncing between the 2 most mild versions and still no clue what was going on. Now, I'm working at a job that I love. So how do you think it affected me to have a job, and I had already established a baseline of performance at that job? How much energy I put into that job, how well I performed at my job with the tasks I had to do. When I was depressed, of course, it affected it. I was slower. And when I was hypomanic, I suddenly was doing more than normal, but not quite as thoroughly, not quite as good a job. I was a little sloppier. And so I'm really just feeling around in the dark as I went through all of these things. I literally knew nothing about what was going on. But then things got a little more extreme, and I was forced to recognize that maybe this was something bigger, because my next depressive episode wasn't mild, it was moderate. Moderate depression for me meant I went from sleeping my normal 7 hours a day, suddenly I needed 10. And if I didn't get 10, I was dragging throughout the day. But then, you know what? Even when I got 10, I was still kind of dragging throughout the day. The mental acuity was even duller, and it was affected even more. And my social life was reduced even more as a result. I didn't want to be around people. I can tell you this: if I was experiencing mild depression and today was to give this talk, I could give this talk. You wouldn't know because you don't know me, but I would be just a little, less animated. I wouldn't be as good. But I can tell you this, that if I had moderate depression, and certainly if I had severe depression, I would have had to cancel. It would not have been possible to stand here and talk for 45 minutes, or let alone 5 minutes. So these are the ways, and just for the record, you've only just met me. Clearly talking is not difficult for me. Clearly it's the thing that, kind of is easy for me to do. So for me to not be able to talk, it was very jarring. It was very clear that something was wrong. So I went through this, and again, it was about 2 months of this depressive phase. And then I went back up, but this time I went into moderate hypomania. Now, mild hypomania I would describe this way. All of you have exhibited mild hypomanic symptoms or traits after you've had a coffee, or after something good has happened and you're a little bit amped up, or after you've done a workout. Those things are normal. To feel that way is normal. The difference is you feel good after that coffee for about an hour, then it comes back down. You feel good about that thing that happens that you're excited about, the good news you just learned, and then you come down and you settle down back to your baseline. When I was hypomanic, I was in that heightened level 24/7. Now, moderate hypomania, it's a little easier to tell something's wrong. Now I'm kind of racing all the time. I can't talk at a normal pace anymore. I'm speaking really quickly. I really am not very good at work because I want to do everything, and I don't do any of it very well. I don't finish any project. I have this sort of, it's the way a lot of people would describe attention deficit disorder. It's similar to that in that I had rabid interest in a lot of different things, but not a lot of follow through. So we get to this point, I've now had 4 cycles of up and down. And my fiance, God bless her, she recognized, I think something's wrong here. I think you might have a mental illness. And here is where stigma reared its ugly head for the very first time. It wasn't from someone else. It was from me. I had been part of the problem all along, and I had no idea. And here's why. My mother had suffered from severe clinical depression my whole life. My memories of my mother from 5 years old on, 4 years old on, she struggled with depression. My dad was a very even-keeled, happy-go-lucky, highly productive guy. I made the snap decision as a kid that dad tries hard, mom doesn't. And I judged her. I didn't tell her this. I didn't treat her badly, but I thought it. And I didn't even really realize that I was thinking this until I started applying it to myself. I started thinking, I can't have a mental illness because I'm like my dad. I'm not like my mom. I'm strong. I'm willing to work hard. I'm willing to do what it takes. This can't be a mental illness. And so when my fiance suggested it, I recoiled. It was all me suffering from self-stigma. And the way I finally learned, I'll never forget, I don't actually remember her name, but God bless her, I saw a psychologist. And the reason I saw a psychologist, let's wrap your head around this little bit of psychology here, is a guy was so afraid of mental illness that he went to a psychologist hoping to find some sort of uncovered trauma from his childhood that was causing these symptoms because that made more sense to him. So that's what I did. 6 months, I saw this psychologist. I told her everything. I was totally compliant to the therapy. And it was her who said to me one day, I have 72 patients. You were the least in need of my services. You were the most emotionally organized person I have ever met. Your problem is not based on an emotional trauma. Your problem, and she said this very carefully, I cannot legally say this because I am not a psychiatrist, but I believe you have bipolar disorder. I think you need to go to see a psychiatrist. Now, this was the first time that a medical professional was suggesting to me that I had an illness, and something clicked in my stubborn brain that, oh, maybe I do need to think of it that way. Now, it doesn't mean I instantly lost the stigma. It just meant I finally was willing to pursue it for what it was. So I did. My next depressive episode was extremely severe, and I ended up going to the hospital, getting a 2-month leave of absence, and I was put on an antidepressant. The problem was I had been hypomanic, not manic yet. So they couldn't diagnose me as bipolar. They could only say, you have unipolar depression, we need to treat that. At the time, the drug they put me on was Effexor XR, which is the absolutely wrong drug to put on a bipolar person on because there's a very good chance that it might push them into a manic episode. And that's what I did. Now, the way the manic episode happened was I had been depressed for 2 straight months, and now the depression was severe. Anyone severely depressed is not a pretty sight. I would go weeks where I would leave the house once in 14 days. And I would walk on the mountain. I actually live just on Côte-Neige, not far from here. And I would walk on the mountain for 20 minutes, and that was an epic achievement. There were many days where a shower was just too much to ask. There were many days where I slept 18 hours and then barely was able to have the energy to feed myself something, and then I would lie on the couch and watch a movie. I was essentially not living. It was absolutely horrible, and my poor fiancée was doing everything she could to support me, but we didn't really know. We were just waiting for the drugs to kick in. And boy, did they ever. I woke up from that state. Try to imagine your fiancé is in that state. You go to sleep, and you wake up, and he is in the living room, bouncing off the walls, packing a bag, and saying, I gotta go see my family. Now remember I said I'm from Ontario. So my family is in Orillia, Ontario, 7 hours away. And at 4:30 in the morning, I was telling Lisa, my fiancée, that I'm going to see my family. And she's trying to orient herself to this new reality of what is happening to Jason. And I didn't let her stop me. I mean, she couldn't physically stop me, but I basically walked out that door, got in the car, and drove to Orillia. And I went straight to my brother's place of work, got there at about 8:39, and he was coming to work, and he had no idea that his little brother from Montreal was going to just be there. Try to imagine that, my poor brother. He was very confused. And I said to him, I really would like you to just take some time off work and come for a drive with me. And he said, okay, it's very odd, but I'll do that. And it was from that moment very clear that something was wrong with Jason, but no one in my family really understood it. The only one who knew that I was in a manic episode was Lisa back in Montreal. She was on the phone with my dad, with my brother, trying to get them to see how serious it was. But here's the thing. I'm kind of a moderate guy. Like, I don't really party hard. I don't really do anything hard. Like, I'm the kind of guy who I enjoy life, but I'm not an extreme person. So if I'm manic, which is not a pleasant thing to be, but I wasn't doing the extreme things that some people do. I wasn't spending money like crazy. I wasn't cheating on Lisa. I wasn't drinking or doing drugs that I would never do. I just talked non-stop and wrote non-stop. How I got through the nights? Because guys, a manic episode, you don't sleep at all. I didn't sleep for 6 days straight. From when I woke up at 4:30 in the morning in Montreal until when I was put in the hospital in Ontario, I did not sleep for 6 days. So what do you do with all that time? Well, what did I do? I went to Tim Hortons and I asked them for their placemats. You know those paper placemats? I don't know if they have them in Quebec, but they did in Ontario. And I would get a stack of them, and I would borrow a pen, and I would sit and I would write. What was I writing? Well, if you ask me at the time, I was writing business ideas that were going to make me a millionaire. I was writing full screenplays that were going to make me a millionaire as I sold those screenplays to Hollywood. I was writing all sorts of other ideas, and I was so excited about it. I kept those notes and sadly looked at them a few months later when I was better, and they don't make a lot of sense. They don't. But at least I was not doing anything overly aggressive, which is in fact what caused my family not to act sooner. But as it extended into the 4th day, 5th day, 6th day, now I couldn't even hold a conversation. Have anyone out here, have you heard of pressured speech? Do you know what that is? For those of you who don't, pressured speech is when you speak extremely intensely, but also extremely quickly at the same time. I won't do it for you because I might break the mic, but it's really uncomfortable to listen to. It really is. And I was at a point where that's how I was speaking at all times. So Lisa finally convinced my family, and they did the right thing. They involved the police. I literally was met at lunch with my dad, and as we left lunch, there was a cop cruiser sitting there, and I knew that it was for me. And I walked up to the police officer, confused the hell out of him when I said, "Are you here for Jason Finucan?" And he went, "Yeah." Not what I was expecting, but yeah. And then I said, "Front or back?" Which he laughed out loud at. And he said, "Yeah, you're going to need to get in the back." And I got in the back and I said, "Listen, this is my hometown. I went to high school here. Do you mind if I lie down? I'd rather not be seen in the back of a cruiser in my hometown." He said, "Go for it, no problem." So they drove me to the hospital, and my family signed what was called a Form 1, which is when you are a threat to yourself or others, whether I could have fallen asleep at the wheel while driving in my 7th night of no sleep, and I could have caused an accident. They did the right thing. I was dangerous to myself and others, even though I wasn't actually suicidal. I was a threat or a problem, so they put me in the hospital. The problem is, when you're put in under a Form 1, that's an extreme case. So the nurses and the orderlies in the psych ward, they have to treat it like an extreme case. So when I was put in the room, which looked like you might imagine, an empty room with a pedestal table and leather straps, and they asked me to lie down, and they were going to give me medication to help me sleep. I didn't want that because I knew the medication I had taken was what put me into this state. So I said, "No medication." And they said, "All right, we're going to make a deal. You be calm, we'll leave you alone, just sleep." They put a security guard at the door, sat there reading a novel, and I tried to sleep. And I think I actually fell asleep for a little bit because I woke up and I didn't know where I was. I literally was like, "Well, this is odd. Where am I?" So I got up and there was a big window. And I walked over to the window and I looked out, and my brother's old house was there. And I was looking at it from a perspective that made no sense to me. And I said, literally out loud to myself, "Why am I looking at Sean's house?" And then I hear, "Mr. Finucan, come back to the bed." And I turn around, and there are 8 orderlies, 4 women, 4 men. They say very seriously, "Come back to the bed." I come back to the bed, I lie down, they pounce, they strap me down, and then they put a needle in my leg and they put me to sleep. And I was not happy about it. Now, what I learned later was 1 week before I was put in that room, someone had thrown themselves through that window. These people weren't trying to hurt me, but the reality was the judgments we make about mental illness can affect the way we treat people, and I happened to be treated in a fairly poor way in that moment as a result. Now, I was transferred from that hospital, which was in Aurelia, to a hospital in Penetanguishene, which is meant for this. It's was called the Penetanguishene Mental Health Center and is now the Waypoint Mental Health Center. There, I saw all the things you see in a full-scale mental hospital that are very difficult to see. I had to reconcile the reality that I somehow should be in this space with people who likely were never going to come out of there. It was scary, but I did have compassionate doctors and nurses, and I got finally the diagnosis that I needed, which was, you, sir, have bipolar disorder. You are on the wrong medication. We're going to give you a medication to get you off the manic episode. Then we are going to put you on the right medication for bipolar, which for me was lithium. That is a mood and thought disorder stabilizer. And basically, I had reached bottom, but now I was on my way back up. And that leads me to June of 2005. So everything I've told you just there about the manic episode was February of 2005. June of 2005 was a magical day. I will never forget it. June of 2005, I was taking 5 little white pills of lithium, 300 milligrams each. Not effective yet. You have to creep your way up to the therapeutic level of lithium, because if you go over the therapeutic level, it's toxic. It's a bit of a balancing act. So you can't go up to that dose quickly. You got to take a little bit, do a blood test, take a little bit more, and that's what I did. So I was being patient and had hope. I really did. I had hope that I was going to get better. I felt like I finally had a diagnosis and I understood what I was doing. And I go see my doctor and he says, okay, I've got some good news. Your blood results show that you are just under the therapeutic range of lithium. We're going to take 6 pills tonight instead of 5, and I think it's going to work. You should experience a benefit. Could be 1 day, could be 6 days, but just take 6 a night. I went home, I took 6 little white pills instead of 5. And I woke up, and the first words out of my mouth was, I feel like me. I literally, not I feel better, not I don't feel depressed. I said, I feel like me. And it occurred to me later that I had not had the joy of feeling like myself since all this started back in 2002. It was June of 2005. I'd gone 3 years of literally not for 1 second being at my baseline. I had been either up or down. And suddenly I was back to feeling like myself. Go ahead. No problem. It's okay. No problem. So when you experience that long of a duration where you are not recognizing your own wellness and then suddenly it's back, I can tell you this. If people say to me, are you sure you really need to take that medication? If people say to me, are you sure you tried hard enough? If people question the veracity of my illness, I say to them, 2.5 years, strong-willed, hard-working guy. And I may as well have been looking at that screen and saying, turn black, turn black, turn black. It was a waste of time. I had a biochemical imbalance in my brain. I needed lithium to correct it. When it did, it corrected it. And I was finally back at a place where I could operate as someone living well with an illness. I use the reference to diabetes all the time because I really feel like it's very similar. If I'm diabetic, I need insulin in order to have a body that functions properly. And if I don't take the insulin, some pretty dramatic and bad things can happen. And if I take the insulin and manage my illness well, I can live well with diabetes. You don't get cured of diabetes and you do not get cured of bipolar, but you can live well with it. None of these things would have happened if I had not overcome the stigma. That is a huge point. And so we're going to go back a little bit to when I was at work. There was, even though I worked at a university, even though I worked with people that I liked and liked me, who respected me, who were intelligent, who were well-read, these people also suffered from stigma just like I did. And it led to something that I wrote in a blog called the Get Well Card Incident. And it's a very little dramatic way of putting it, but what that is I was off for over a year in one of my leaves, and I didn't get a Get Well card until 6 months in. And when I did, from my team, the people I worked with every day, and when I did, not only was it late, it was only signed by them with their first names, like Jason and Lee, and Ryan, Anthony, Liz, not miss you, get well, no notes. No notes at all, just their names. Now, were my colleagues trying to make me feel bad? No. But they didn't know what to say because they didn't know what my illness was because I had a stigma about it and didn't disclose it. All they knew was Jason was off sick. This is the kind of thing that would never have happened if my heart problem had come back instead of bipolar showing up at 26. What would I have done if my heart problem had come back? I would have declared my illness to my boss, she would have told my team, and I would have been awash in cards and flowers and empathy and support and zero judgment. So I come back to work after my long leave, and I had forgotten about the get well card. Honestly, totally had forgotten about it. But it was awkward coming back. It was awkward to try to figure out how to connect with my colleagues again. And what ended up happening was one of my colleagues, poor guy, got really sick. He got a virus, a very odd virus that put him in the hospital. He was there for 2 weeks. On the second day he was in the hospital, I get an email that says, everybody got an email that says, come sign the card for Don. Perfect. Don's in the hospital, we're all gonna sign a card for him. That's the way it should be. I go to sign that card, and it's about the size of this. And it's on a table, and when you open it, like, there's an insert because they're so full that they had to put an insert of cardboard so that more people could sign and write their notes. Don, my God, I can't believe this is happening to you. We miss you. Come back, et cetera, et cetera, et cetera. And I added my own note happily, and I write the note out, and then I start walking back to my office, and I feel this fury rising in me, and I have no idea why. I'm like, why am I mad? That's odd. And then it occurred to me, what's the difference? Why am I gone for 6 months and I get a card signed awkwardly by first names? He's gone for 2 days and he gets this card. Was it because people liked Don more than me? No. It was because people understood what was happening to Don and they didn't have a stigma towards it. They had no idea what was happening to me, but they kind of suspected it was a mental illness and they had stigma towards it. So that's an example of how stigma can permeate the lives of all of us at work, and of course this can happen socially as well. I'd like to finish, I'm almost finishing off, but I'd like to go back to my journey to advocacy. So you go through all of these sorts of things, you have to become a little selfish, you have to become self-focused. You're trying to figure out, how do I get my health back together? How do I get my life back together? And eventually, I was fortunate enough to do that, and I do want to stress that word. I was so lucky that lithium worked for me the way it did. I have friends, I have siblings, I know many people for whom medications for mental illness don't work so black and white, don't have such a dramatic positive result. And so I was fortunate. I had that ability to, for whatever reason, the biochemistry worked, and I was able to feel well again. And so I'm starting to crawl along, getting better, starting to, frankly, believe it's going to last. That was the hardest part. For the first 6 months, I spent every day sort of waiting for it to come back. I was afraid that this was just some sort of brief window. But it kept going and kept going. So then I was well enough to go back to work. And I went back to work and had that get well card incident and just was living my life. And now I'm well enough that it occurs to me, okay, I kind of have these 3 things. And they're random. And they just happen to have happened to me. One is I had a major physical illness and a surgery and learned what it was like to not have stigma attached to something that happened to you. Then I had bipolar disorder and I learned the hard way what it's like to have stigma attached from yourself and from others. And the third thing, honestly, is just a fluke. I liked public speaking as a kid. I took a degree in theater and speech communication. Talking is easy for me. So the experience combined with the comfort level of talking made me realize I need to do something about this. And so I went to AMI Quebec, who had helped me when I was sick. I had taken their mood and thought disorders course. And I went back there and I said, I want to volunteer for you. What can I do? This is what I feel I have to offer. And that was in 2006. And to date, I have done over 42 presentations to 15,000 people at 42 different locations. So CJADs, high schools, companies, all of these things, just helping spread this message, helping be an example of someone who was lucky enough to get better and who understands how and why we need to get rid of stigma. And that's what led to my advocacy becoming a professional thing. And it, in fact, was my wife, who has a business degree from McGill. And if those of you are listening really closely, you'll recognize that can't be the same person. because the other one had a degree in a PhD, exactly. So no, when I said at the beginning that mental illness can tear relationships apart, I am an example of that. That relationship ended as soon as I got better. When I got better, and this is no disrespect to her whatsoever, my analogy is it's like somebody sees that you have a car on top of you and they try so hard to pick that car up that they break their own back. That's what happened. She helped me so much that she was broken when it was over, and she could not imagine living with the threat that it might come back. And I recognized that, and I said, let's just go our separate ways, no harm, no foul, and we broke up as friends. And it's an amazing thing, though, because if that hadn't happened, I would never have met Anna. And my wife, Anna, is the reason that I do this. She's the one who encouraged me to do it. She is the one who, in fact, one day came to one of my talks and said, you need to do this for a living. Like, stop doing it as a volunteer. You need to do this all the time. And that's a terrifying thing. I have a job, I'm a fundraiser, I have a career. I'm just gonna quit that job and try to start a company and do this kind of work. It was a little bit scary, but she gave me the freedom and gave me the encouragement and the self-belief that it not only was needed, but that it could happen. And so I founded my company, Stigma Zero, and this is what I do. And I do it, I really hope you know this, I do it not because I love to talk about myself. That's my joke. I'm like, it's really not about that. It's about taking a set of experiences and trying to help others to learn from it. And if I can shorten anyone else's time window, it took me almost 2 years of bashing my head against the wall to figure some of these things out. I hope to accelerate that. If you're a caregiver, if you're somebody who is suffering from a mental illness, if you have any stigma whatsoever, I'm hoping that you'll recognize that it truly is a physical illness. The fact that we call it a mental illness is essentially a misnomer. It's a happenstance. Why is it not called a brain illness? I think if it was called a brain illness, we might actually have a little bit less stigma around it. Because if I say mental, you think mind, not brain. And if you think mind, you think character. But if I say I have a brain illness, you don't think about my character, you think about the hunk of meat in my skull. And that's really what it is. There is a brain in here, and it's just not working right. It needs intervention to work right. So I would like to finish off with a few words that bring back, I started this talk off in a slightly negative way, if you really think about it. I'll remind you what I said. I said that mental illness is unfair. It can devastate lives. It can ruin careers. It can tear apart relationships. And in the saddest, most tragic cases, it can end lives. All of that is still true. Now, I'm not trying to bring you down. I'm trying to help you realize that we can't focus on the larger picture of the illness that we can't change. How do we react to cancer as a society? Yes, we want cancer to be cured. That would be fantastic, but it's not cured right now. It still happens right now. So what do? We focus on treatments. We focus on research. We focus on things we have some control over. But we're not doing that as well with mental illnesses for one simple reason. We have one arm tied behind our back, and that is because of stigma. We're not responding to those illnesses in the same way. And I believe that the first thing we have to do is get rid of stigma, and I believe that we can do it. So my message may sound negative at the beginning, but the truth is it's hopeful. It really is hopeful, and I'd like to share with you where I get my inspiration. I have an absolute belief that we will eliminate stigma. And the reason I believe that is because historically we have an example to draw from. Do you know that in 1940 and 1950, a woman with breast cancer also would have to deal with enormous stigma? Anyone who's young probably thinks, what? And anyone who's older thinks, yeah, actually that's true. Because it was. There was enormous stigma around breast cancer. It's ridiculous to think of it today, but it happened that way. Now, a woman in 1940 could not even imagine that 50 years later, there would be unanimous support for breast cancer patients and research. There would be pink ribbons, denim days, Girls for the Cure, walks, rallies, and absolutely zero stigma. The thought of imagine seeing stigma applied to a woman recently diagnosed with breast cancer, imagine how you would react. You would feel shocked, confused, angry. It would be unacceptable. How did we do it? How did we go from where we were in the 40s and 50s to today? Well, the answer is awareness, it's education, and ultimately, and this is the key, awareness and education alone won't do it, society needs to recognize, and did recognize, that breast cancer was an illness happening to that person, not something that they could control, that was a character flaw, or was their fault. It's an amazing thing. As soon as you recognize an illness as something happening to someone, you stop the judgment. You stop any stigma. And eventually society did that as a whole, slowly, bit by bit. And we reached a point where it was simply unacceptable to have stigma towards breast cancer. And so we did it once. We did it with many other things. We're doing it all the time. And there is a conversation that's going on, that's been going on for many years, and our panelists are a huge part of that. They're going to talk about it when they're up here. We've got Bell Let's Talk. We have events like this. It's a wonderful thing. But we all need to rally and continue that effort in order to end that stigma. And so I have a challenge for you. If you have a stigma towards your own illness, as I said before, recognize that it's a physical illness and treat it with the social constructs you would cancer. If you have a stigma towards somebody else in your life who has a mental illness, do the same thing. Recognize it's not that person's fault and ask yourself, how would I help this person if they had an illness like cancer? If you are free of stigma, if this is a me preaching to the choir situation and you're like, yeah, I get this, buddy, I know it. I don't have stigma at all towards mental illness. That's fantastic. Be a leader in your social circles and in your workplaces to help others get to where you are. Events like this by Mindstrong, co-hosted by leaders like the JGH Hospital Foundation and the JGH Auxiliary and WELLMTL. These kinds of events are so important to move this conversation forward. The goal is not just one person speaking to a group. It's not just 4 panelists sharing their opinion. It's what you all do with it. It's what you do as you leave this room tonight and you go out there and you just simply make that effort to stop letting stigma exist in your mind or in the minds of others. Thank you. Thank you so much. I'm going to see if there were any questions collected, and I will happily refer to those and answer those for a few minutes. Here, I can start with a few.
Sure.
So while there are more questions being collected, I have been given a few, and I'd like to go through those, if you don't mind. We've got about 5 minutes, maybe 10 minutes to do this. This question says, thank you, can you get through depression, anxiety, and panic disorder without medication? It's a great question. And the answer is, absolutely, in some cases, that's possible. The thing that makes mental illness so challenging and so difficult and why treatments don't work very well is because everyone experiences depression or anxiety or bipolar disorder or whatever their illness is very differently. I'll give you a very good example. I have bipolar 1, the most severe kind of bipolar. My older brother Trevor, he's been diagnosed with bipolar 2, but he also has anxiety disorder. So that means he's never been fully manic. He's never had a severe depressive episode, but he constantly oscillates between mildly depressed and mildly hypomanic and has anxiety kind of running through the whole thing. So at first glance, if you don't know what you're talking about, you might think I got the worst diagnosis because mine's more severe and I could go all the way to mania and I could go all the way to depression. But in this case, my illness was actually a godsend compared to his because it was so precise, and then the medication, the treatment actually helped so well that I recovered and reached a level of wellness that he's never been able to reach. Medications for him react very differently. Even ones I've taken that have worked for me don't work for him, and we're brothers. So imagine how different it could be from one person to another. So I do know instances of someone who has mild depression and mild anxiety and has maybe had one panic disorder or one panic episode, but those instances, maybe they were more tied to a life event. Maybe they were more tied to a stressor. Remember I told you at the beginning I had nothing wrong in my life and then I became depressed? I was an example of someone without a stressor. So that's a little clearer. It's very clear that, okay, well, this is likely an illness. But what if you have a major stressor? What if you lose a loved one, a very close family member in a tragic accident? Well, that could initiate a panic episode, or it could initiate anxiety disorder, and maybe you might be able to recover from that without medication. But the way that I've always looked at it is, it's all about how long you want to live with those symptoms. If you're living 6 months, a year, and those symptoms are not going away and not getting better, and it's really disrupting your life, I think it's worth trying treatment. That's been my attitude all the way through. The next question, what is the best drug on the market for geriatric mentally ill patient who is depressed and anxious? And I have to tell you that unfortunately I am highly unqualified to answer that question. I don't flat out know at all. I'm 42, so I haven't quite experienced mental illness in that way. And I wish I could give you a better answer, but I would stress to say, ask your doctor. If you have access to a psychiatrist, ask your psychiatrist. Do internet research. And there's something very important that I've done ever since I lost my stigma, ever since I let it go, was I recognized, okay, I have this illness, just like, okay, I had this heart problem. I own my illness. I took ownership of it. And I decided that if I'm going to live with this thing, I may as well be a partner with my doctors, with my caregivers, and with anyone in my life. I'm an active participant in my wellness, in trying to get better. And so that's what I would say is be an active participant and try to learn as much as you can. Hi. That's okay.
Thank you.
So this next one, you and many others compare physical illnesses like diabetes with mental illnesses like bipolar. Yet diabetes, for example, is easily diagnosed through blood tests, and there are other diagnostic tools for other physical illnesses like cancer. Absolutely. So this is the thing. Mental illness is not easily diagnosed, as is clear from my story, all those years I went through. When I make the connection between diabetes and mental illness, that is for someone, anyone, who hasn't yet thought it in their mind that really mental illness is an illness. They're stuck on the stigma, they're stuck on the judgment, they're stuck where I was with my mother, that maybe this is something this person could just try harder, this person could just change their outlook. That's a very useful tool, but 100% it is true. If you are suffering on the early stages of a mental illness, it is very difficult to find those results. It takes a lot of patience, and you can't look at it quite as black and white. However, I will say this. If you're doing what I was doing and feeling self-stigma and denying the idea that maybe you might have a mental illness because you were ashamed of that thought, then think of it like diabetes, because it is like that. So that's a tool to help get rid of stigma. What has the federal and Quebec government done in terms of funding for mental illness support? There were cutbacks in Quebec. That is a giant question, and again, I can only give a little bit of information based on what I know. The reality is, absolutely, we do not have enough funding when it comes to mental illness, when it comes to research, when it comes to facilities, but it is heading in the right direction, slowly but surely, and we need to keep this conversation going in order to make sure that it continues that way. Beyond that, I wouldn't be able to answer. This question is if you suspect or you know that a close family member suffers from a mental illness but no one else sees it and has stigma, What do you do? How do you tell them? How do you make them go see a psychiatrist? That is such a great question. When I do talks, in particular at schools with grade 7, 8, 9, 10 students, they often have that same question is, how do we have that first conversation? Or worse, how do I tell my parents when I know they have a stigma towards mental illness and I know I am suffering from anxiety? When you're dealing with somebody who is in denial, so I was in denial for almost 2 years and my fiance was trying to get to me. The best way is to recognize that you can't change anyone's mind right away. It's a slow process. And number 2, it will never change if you approach it combatively. It has to be, your discussion with them has to be about observations that you've made about their behavior and concern you have about their wellness, not you're acting weird, but I've noticed that you've been acting differently. Are you okay? So language becomes really, really important if you're going to have that first discussion with somebody. And that doesn't matter whether that's your parent or your sibling or your friend or your child. The language always has to be non-judgmental. It has to be, they need to know that you aren't approaching them from a stigmatized point of view. That's what they're afraid of. And in fact, if they're having stigma towards themselves, they're already stuck in that mindset. And so getting them out of that mindset is only going to begin to happen if you can show, I recognize that you might have an illness. This is not your fault. I just want to help. All of those kinds of statements go a long, long way to, and I have to give my ex, Lisa, a lot of credit. She said all of those things, and she waited. She was patient. You do need to be patient. It may not happen overnight. And if there are resources or role models that you can lead this person to, then do that. That's another thing. I mean, we have this wonderful thing, the internet and YouTube, and there is so much out there. If you can key in, if it's a young person, maybe they have a role model who has spoken out about mental illness, and you can speak about that and get them to look at it that way. Thank you so much for your thoughtful questions, for your attention. I appreciate it. Now I'm going to switch hats and become your panel moderator. So, give me 1 second. We will do the same thing with the panel that we did with my keynote when it comes to questions. If you have questions for the panelists that you'd like me to read out to them at the end, raise your hand. A volunteer will come by with another cue card. You can fill it out and we'll collect them at the end. So to start off, I'd like to introduce our panelists. I'm going to fully introduce you and then I'll have you come up one at a time. Our first is Dr. Anthony Gifuni, recently graduated from the McGill Psychiatry Residency Program. Anthony is currently a resident in the Clinician Investigator program at McGill. He is also conducting a PhD on the neurobiological basis of depressive disorders and suicidality in adolescents and young adults. And I get extra points for saying that properly. When not working on his PhD or residency, Anthony is a psychiatric consultant at the English Montreal School Board and works part-time at the Health Services of Concordia University. Let's give a round of applause for Dr. Anthony Gifuni. Next we have Ryan Golt. Ryan is a second-year master's student in the Department of Educational and Counseling Psychology at McGill University, working as part of the DAIR research team. His research focuses on developing and evaluating programs surrounding mental health resilience and decreasing stigma in young adults and adolescents. Clearly, we have a little bit in common. In addition, Ryan is also the founder of WELLMTL, co-host of this event, which aims to help people overcome the social and financial barriers of mental illness. Round of applause for Ryan Golt. Lee Haberkorn. If Lee's voice sounds familiar when he starts to speak, it's because he's a rising star in radio since 2014, when he won a contest to be a Virgin Radio announcer for the summer. A natural at hosting radio and emceeing public events, Lee has made a name for himself in Montreal as well as in Kitchener. He currently co-hosts and produces Virgin Radio's Freeway and Natasha in the Morning. Today, Lee makes the most of his platform by discussing his struggles and sobriety, opening up a frank and sensitive discussion about mental health issues and substance abuse with his listeners. Round of applause for Lee. Last but definitely not least, Liz Wiener, a teacher by education and a mental health advocate by vocation, Liz is passionate about helping to break the stigma associated with mental illness. Fueled by her own struggle with depression and anxiety, Liz strives to open up the dialogue, normalize mental illness, and continue the conversation until there is no shame left. As co-founder of the blog Wise Women Canada, a mental health columnist for Best Health magazine, and co-host of the CJAD 800 radio show Wise Women, Liz encourages the community to own their stories and their struggles, step outside of their comfort zone, and embrace the strength that comes from vulnerability. Round of applause for Liz. Okay, so we're going to start off the panel with a few questions where we would like, oh yes, you need microphones. Thank you. Make sure that's on. Thank you. We're going to start off with a few questions that are going to be answered quickly, briefly, sort of fast start questions. And this one is for everyone, and let's start with Anthony and go to Liz in order of answering. How long have you been a mental health advocate?
I entered medical school in 2005, and I think it was part of my vision of medicine. And advocacy is a quality now recognized as fundamental in medicine. And you know, after all these years of training, it's still part of me. So yeah, to this day.
I became an advocate, I guess, the second I shared my story on Facebook and had about 100 people message me within an hour saying they're going through the exact same thing I'm going through and they don't have the voice yet to share their story. And once I got 100 of those messages, and I'm not exaggerating, I realized there needs to be something done about this. People shouldn't feel like they don't have a voice, and that's when I committed myself to having a career in mental health.
So for me, it's been, it started about 9 years ago on a very small scale, being in sobriety, kind of changing my life. And what I mean by a small scale is I was trying to help individuals that were going through a lot of the same struggles as me. Younger people in sobriety, people that were in the rehab that I went to. But about 4 years ago, when I started working at Virgin Radio, and I realized I now have this platform that I could use, what kicked it off was Bell Let's Talk. And I was like, I have people that are willing to listen to me, and I use it for fun, silly, ridiculous things so often. I need to use it for good. So for me to open up about my message, ever since that day, it's not just on Bell Let's Talk, but it's year-round that I try to do a lot of these talks and be an advocate and show, if I could show just one person in this room, hey, there's light at the end of the tunnel, it's worth it for me.
So for me, my story is sort of similar to Ryan's. I have a blog with my partner, Lisa, who's here tonight to support me. And I decided one day, shortly after Robin Williams died, that I wanted to share my story. I've been living with anxiety and depression since my whole life, I think, only diagnosed at 24. And I wrote this piece about my struggle. And I published it, and I went into a yoga class. And I came out of that yoga class an hour later, and already thousands of people had read it. And I realized then that I touched on something, and that my story was the story of so many other people. And that was the beginning of my decision to use my struggle, my journey, to help other people.
Fantastic, thank you. And we're going to continue with quick answers, and this time we're going to go from Liz to Anthony. Can you remember a time when speaking publicly about mental health in general, let alone your own personal experiences, would have been terrifying?
Absolutely. Like I said, I was diagnosed at 24. 20 years ago, more than 20 years ago, nobody talked about mental illness. I couldn't imagine ever being vocal about it. For me, there was this perception of being seen as weak, and I stigmatized myself. I said, well, this is something I caused. This is a defect in my character. So absolutely, there was no way that I would have spoken about it to anybody. Only the people in my closest inner circle knew about my struggles.
Yeah, I think, if I look back to before I got sober, there was not a chance I was going to mention to anybody that I wasn't perfect or that I was broken in any way. So I was just terrified because I lived my whole life. If I could convince you that I'm okay, maybe I'll start to believe it. And then if I fast forward a little bit after I got sober, I remember being terrified. Even though I'm starting to like myself and come to terms with everything, dating for the first time and having to sit across from one other individual and say, you know, I'm not perfect. I have some struggles. That was a huge hurdle for me to get over for the first time.
Yeah, for me, I touched upon this briefly at the beginning. For those first 6 months, besides my parents and maybe one or two other people, I really didn't let anybody know what I was going through. And once I shared that blog, everyone messaged me saying, you know, you're the last person I would have expected. I didn't tell my brother and my sister, who are two of the most people in my life. Some of my best friends who are here today, I didn't tell them either. And I let it affect me. And then I guess I went from an all or nothing to knowing to the whole world knowing. And now, you know, it's actually interesting because, you know, I'm now viewed as like champion of the stigma. But every now and then, you know, you still feel it a little bit. Sometimes when I'm going to the therapist, which I still do, and someone says, where are you off to? I'll just, doctor's appointment, you know? Not necessarily a therapist. So, you know, from where I was then to where I am now, I don't feel stigma as much, but, you know, that 1%, it's still there.
Personally, in terms of public speaking, I realized the importance of that kind of stories. And very early on, my medical careers, I started doing presentations in high school, and I think that's an age where we're really open-minded, and we can have a real impact in terms of how we see mental disorder. It's an age where the first symptoms of mental disorders often appear, so it's even more important to talk about these issues at a young age, while, you know, otherwise it's met with ignorance or with people that don't know much about it.
Thank you all for sharing that. We're going to go with one last strong start question with quick answers. And this time we're going to go in random order, so just answer this as you will. When you agreed to be part of this panel, what was your goal for the audience?
That's easy for me. It's exactly what I said before. Anytime I speak anywhere, whether it's a post on social media or going somewhere, if I could help one person in the audience, and just, you know, whether it's by example or knowing that it's okay to reach out to somebody that's struggling, or that if you're struggling, that just talk to somebody. If I can help in any way, then it's worth it for me to break my anonymity and for me to out myself with all these things. So, you know, hopefully one of you gets a message like that.
For me, I think my message was that mental illness doesn't discriminate. I think the single most common question I get in my life is, or statement directed at me is, well, you don't look like you suffer from mental illness. And what does that even look like? What does it look like to struggle with mental illness or to have some kind of depression, anxiety, bipolar? You know, if I said to you, Jason, well, you don't look like you have bipolar disorder.
Heard that many times.
Right. And I think that was my message. There's no look. It doesn't discriminate. It affects every cultural, religious, socioeconomic group. It could be the person sitting next to you. 1 in 5 Canadians are affected by mental illness, and there's not a look. You don't look a certain way when you struggle with mental illness. And just my greater message is just be kind, because everyone you know is fighting some kind of battle.
I think my goal for tonight is just simply, it's an important evening. People shared personal stories. And here I'm representing two things. I'm representing psychiatry as a profession and a new member of it, and also I'm a researcher. So the hope embodied with research, and what are the things that we can bring up with that. So I represent those things, and I think the importance for our profession to listen to those stories, and so that we can try to improve things and meet patients where they're at and that they feel listened to.
Yeah, the line that I just mentioned that's been my passion throughout all of this is when people kept on saying, thank you for giving me the voice that I do not have. So that's been my motivation with this whole process, to help people find their voice for the unfortunate whatever reasons that they feel like they don't have one. And that doesn't mean that everyone here needs to go home and write a blog. That just means that if you wanted to, you could be able to, and you won't feel any shame for doing that.
Excellent. Thank you for that, guys. And now, you know, I'm going to give you a little bit more breathing space. Let's dive a little deeper with this next question. Now, I have a specific question for each of you, and you can take your time and really kind of round it out. So, Ryan, let's start with you. Why did you launch WELLMTL?
Yeah, so as previously mentioned, it started with some initial programs where it was stronger than stigma at first, which is at the university level, where we helped to give a platform to people to share their stories. And also that we host mental health weeks or different initiatives where people can learn about mindfulness, people can learn about CBT, which is cognitive behavioral therapy, people can do exercise, yoga, dance, whatever it is they want to do to feel mentally healthy. We want to give them a platform to do it. And then for my master's research, I created an anti-stigma program at the high school level called the School of Talk program. And I've already spoken to about 500 students, and the feedback has been really incredible. And for both Stronger Than Stigma and School of Talk, I've done my own research, once again, for my master's, proving that students are leaving these programs with less stigma than when they entered. As everyone on this panel knows and has mentioned already, education and awareness is where it all starts. If you learn and understand what mental illness is, how could you possibly have a prejudice against it? It just doesn't make sense. Same way you said, if you never stigmatize someone with breast cancer right now, at least I like to believe we are born innately as good people. So we're not gonna stigmatize people because we're born good. So I built up these two programs, and I love doing it, but more important than that, I recognize this need, and I recognize how much more of a need there is. So I'm currently in the high schools and universities, but I'm not in elementary schools, I'm not in workplaces, I'm not maybe in summer camps or whatever. And the goal is just to continuously have an ability to create all these different programs, obviously mental health related, put it under the WELLMTL umbrella, and most importantly, make them incredibly affordable and accessible to whoever inquires. Because as mentioned, and as I'm sure I'll come across later, there's so many barriers to getting proper mental health and feeling comfortable with yourself. We don't need to add any others.
You know what? Thank you for that, and good luck. Good luck. I think it's an important initiative, and I wish you every success with it. Let's go to Liz. Liz, could you please share the story of how Wise Women Canada came to be?
Sure. So it was by coercion, actually. My best friend had this idea of creating this online resource for Canadian women where they can go and get information about, where to get their hair done or, veterinary care or personal training. And it was great once I finally agreed to be coerced into the project. And then really going back to the blog I talked about before, one day I just said, I need to put my story out there. I'm really tired of keeping it a secret. And like I mentioned before, the response was incredible. Like Ryan's saying, people were saying to me, you're telling my story, or thank you for sharing your story. And we realized that we had touched on something. We had this great venue for people being able, not just me and not just my partner, but people coming forward and sharing their stories of struggle, of success, and especially of vulnerability. And I think that's, to me, the key. And I don't know if anybody here is a fan of Brené Brown, but she's a wonderful speaker, and she talks about leaning into vulnerability. And in leaning into our vulnerability, that's when we connect with other people. And essentially, that's the goal now of Wise Women Canada. It's a place for people to share stories, for leaning into that vulnerability, and for being able to connect with other people, because we all have some kind of struggle. And in sharing those struggles, we're better supported by the community.
Absolutely. Thank you for that. I did not know it was coercion at first. That's great. Lee, I'd like you to respond to this one. There's a video that you made for the 2017 Bell Let's Talk campaign where you are standing on an overpass downtown. Can you share the story behind that?
I'll jump it right in there. So it was 2016. That was the first.
16. Sorry.
The first Bell Let's Talk. Does everyone know what Bell Let's Talk is? I mean, I'm assuming yes. And what I want to say about that first is I still get the question, which is crazy, from friends, from strangers. Say, Bell Let's Talk, that's fantastic. Bell does something for one day of the year, but what else could they do? Or really, they're just after the publicity. They're just after the marketing. You know what? If they are, I don't care. Because for that one day, everybody in this room now knows about it. Everybody around our country knows about it. So it's like, if they're doing it and there's some ploy that I don't know about, I'm completely cool with it. Okay, completely cool with it. So that first video I did, which was absolutely terrifying, because that was the moment where I realized I have this platform, I could speak up, I have people that, in some way, for some ridiculous reason, look up to me. I could take advantage of that for good. And what happened was I made this video, I produced it, I edited it myself, And I put it on my computer, and I'm looking at the button to it. Because at this point, like, okay, people knew I was in sobriety, that I don't drink, that I've had some struggles in the past, but I was about to share the most intimate part of my life with what would turn out to be 300,000 people watch the video. So I pushed it, and I was terrified. What the story was, you know, almost to the day 9 years ago, my life had gotten so bad, and I was so miserable with myself that I thought the only solution was to kill myself. I had been in, you know, depressions, I had had anxiety, but everything was coupled together with drugs and alcohol. So, you know, which one triggered which? Frankly, I have no idea. Which came first, the chicken or the egg, right? It was all together. It was just this perfect storm, but really it stemmed from years of being insecure, years of having fears, and letting that kind of fuel me and my whole life. So I just kept hiding and kept brushing all my problems underneath the rug. And it took me to a place where 9 years ago, I was like, yeah, you know what? My family wants something to do with me. My friends are ashamed of me. I hate myself. So I walked to Carrie, was holding onto the ledge, completely at peace with the fact that I was going to kill myself. And all I was waiting for was that little tiny burst of energy out of my toes to actually throw myself off. And I didn't do it. And what I ended up doing was actually walking to this hospital and going to the emergency room. And this is a hospital. And I walked up and I knocked on the glass. I said, "Excuse me, I want to kill myself. Can you help me?" And the reaction was, "Excuse me?" Because it's normal to come in and be like, "I broke my arm, can you help me?" But for somebody asking for help, something like that, it was kind of incomprehensible. Then you fast forward a week, I knocked on the door of a rehab. I said, can you help me? I want to come in. They're like, what? It just doesn't happen. So I decided to take advantage of the position, you know, that I'm in, because I'm very fortunate. And when I shared it 3 years ago, I mean, was it 16 or 15, whatever it was. And so now I make it a mission. Yes, every year I put out a video for Bell Let's Talk. But it doesn't end there. You know, what that video did for me was put me at the forefront of kind of, I think, the Montreal conversation for suicide, for addiction, for mental health issues, and exactly what kind of other people were saying. You look at somebody like me, I'm confident, I'm outgoing, I'm fun. You would never guess that I'm filled with insecurities, and that's how I used to run my life. You would never guess that I wanted to kill myself and I hated myself, because today I'm like the biggest advocate for Lee. Like, nobody loves Lee like Lee loves Lee. You know?
Thank you so much, Lee, for sharing that. I know it's a tough story, but it's such an important one. The fact that you got to that point, and then the most important part of that whole story that you said was, but I didn't. And then you went and got help. And the fact that you've taken that and now you're sharing it, it's huge. So thank you. Anthony, I would like to know, what motivated you to become an academic in the field of psychiatry? How did you come to that decision?
Well, I'm touched by such stories. That's the answer. And I'm touched that it's still difficult to access treatment in psychiatry. And that's a message for everyone. It requires a lot of determination, because Lee, you could have knocked on that window and then say, that's not for me, and just leave. But you stayed, and that's the important thing. And even if you enter, it's often a process of trial and error. And this whole thing that we can still not see the actual source of suffering, that our treatments, we're not sure if they'll work. That's the reason why I decided to go into academia, to do research on top of being a clinician in psychiatry. Brain is the final frontier in science. Now we're pretty good at launching rockets toward Mars, but still we haven't figured out depression. And that's something most of us will struggle in life, or know someone that will have to. And here in Montreal, you know, we're inspired. We have a street named after Wilder Penfield, who's a great neurosurgeon. And now neurosurgery enjoys techniques such as imaging. So you could image the brain and see where is the tumor. And then open the skull, remove the tumor, and it's It's quite a process, but you're guided by objective data. And it's still not the case with psychiatry, and I'm in the field of using neural imaging, trying to, what can we learn from how the brain functions? And it's immensely complex. And just to give you an idea, so we've compared mental disorders to cancer and the fight for stigma. Cancer is immensely more simple than depression, okay? And I don't want to be reductionist about cancer because it's extremely complex. But we understand that cancer comes from a cell that becomes unregulated because of its genetic activity. We've discovered DNA in the 50s, and then we've discovered every cell in the body contains the whole DNA, and then throughout life there's mutations, and now we understand a bit much these mutations, and we have specific treatments. The brain is not just several cells doing the same stuff like breast cancer, it's all mammary glands. All cells do the same. The brain, every cell does something unique. And that's why the brain is so sophisticated an object. So imagine this complexity. Every cell is different and can act differently. So the challenges are immense. And while we're facing those challenges, I think it's important to remain compassionate. That's what I like about psychiatry.
Thank you, Anthony. And that's a really great point. It's a good reminder as to why I was talking earlier about how even two brothers could respond differently to the same medication, and that's why. It's because the brain is so complex, and that's why we sometimes need to exhibit a greater degree of patience as we explore potential treatments and solutions for this. For the next question, Liz, I'm going to go to you. You mentioned it earlier. I'd like you to go a little further into your first public writing about mental health was shortly after Robin Williams' death, but you waited for months to publish it. Can you explain that?
Well, yes, I was very stigmatized by my own mental illness. Like I said, diagnosed at 24 with depression, generalized anxiety disorder. I spent 20-something years not talking about it to anybody. Nobody knew, except my very closest friends and family. And I really was very concerned with publishing my story and how it would be perceived, mostly because I thought I'd be perceived, as I mentioned before, as weak, as somehow defective in character. I really still blamed myself for my mental illness. But also I was very worried about my family, about my husband, and about my 3 children, because stigma doesn't only touch the person who struggles, but it touches the people who support them. And I didn't want my kids or my husband to be perceived in a certain way, or for me to be judged as a mother, as a wife, as a career woman. But at the end of the day, I said, I want my kids to know that it's okay to own your mental illness, and it's okay to own your story. We all have struggles. And I would never want them to be ashamed if one day they were to suffer from some kind of mental illness. I'd never want them to feel the shame that I felt, and I'd want them to feel comfortable getting the help they needed. Because I can only imagine if I'd really owned my mental illness 20-something years ago and really got on the right path to healing, what a difference it would have made.
And that's a really great reminder of the fact that, we're all standing here in front of you and in that sense leading by some sort of example, but we lead by example in our lives. And you doing that for your children, they have that role model to look up to, that if in their 20s or 30s, they're suddenly experiencing a mental illness, they're not going to have nearly the battle with stigma because of what you did.
I wanted to add also that my son, who's 17, is now a mental health advocate in his own right, and he is part of Mindstrong Young Minds, and he goes into schools and talks about his story of mental illness, and he talks about living with a mom with mental illness, and he tells it with no shame and with confidence and with pride.
That is so fantastic. Absolutely. Well-deserved round of applause there. Ryan, I'm looking forward to this one. Your graduation photo from McGill is truly unique. Can you explain what makes it different for those who haven't seen it and how it came to be?
Depends if I'm allowed to swear or not. I'll take it back 2 weeks before that picture was taken. It was actually a McGill medicine event where one of my buddies who I met was hosting this thing. It was called What Keeps You Well. And he just it was a place, once again, this was even before Strong on the Stigma, I believe, where he was giving people a platform to just share a few little things about their mental health or what keeps them well. So he gave me a whiteboard, and he just said, write something. And this was the first time I really felt empowered, and I didn't know what to write. And I'm like, you know what, I know exactly what to write. So I wrote F-U-C-K, the stigma, in big on a whiteboard. And I took a picture with it. So I wrote that in big, and he loved it. Everyone who was taking the picture, they were smiling and like, this is amazing, this is exactly what we want. And 1 week later, they posted all the pictures except for mine. And he messaged me, he says, you know, bureaucracy, because this is a medicine-sponsored event, our faculty didn't let us post it. And I'm like, it's probably maybe a good thing, but I'm like, I really felt empowered sharing that. At that point, I wasn't very vocal. I wrote that one blog, but besides that, I've done nothing else to advocate for mental health and mental illness. And I said, all right, let's figure something out. And 1 week later was my grad pictures. And this is someone who, you know, I was able to graduate McGill University in a double major through a year-long depression, and I was really damn proud of that. Yep. So at graduation pictures, you're allowed to have like a prop photo session where you can bring in whatever you want. And one of my thoughts was to bring in my therapist, actually. I was proud of her. She got me. She was one of the major reasons I graduated anyways. I think I said, you know what, let's recreate that picture, let's write that sign. So I wrote F the stigma on the whiteboard, smiled with my cap and my gown, and I took my graduation picture. And you know what, maybe if anyone has recommendations for the next thing I can take when I hopefully graduate in 2 months, I'm open to it. Yeah. So if I can leave you with one message, it's F the stigma.
For those of you who haven't seen this photo, which I think is most of you, the best part about it is the giant smile on his face. It's just, he is the happiest grad. I love it. Good for you, right? Anthony, what do you see? You talked a little bit about it, and you can expand on it, but what do you see for the future of psychiatry in how we manage mental illnesses in patients? Are we making progress? Will things improve? What do you see coming up?
So, of course, we're making progress, and I think, you know, every generation of psychiatrists has improved on the previous one. Mm-hmm. And when you think of psychiatry, there's still the stigma associated, and it kind of taints everyone that has a mental disorder because of these old-fashioned ways of treating mental disorders that did not respect the dignity of people. Things like that were pictured in One Flew Over a Cuckoo's Nest, or things like that. We have tremendously evolved, and a lot of things have happened since the deinstitutionalization of mental health care. And currently, I think what we're seeing in terms of trend is actually what we're seeing here tonight, is the active participation of people in their care. Instead of being passive recipient of care, we expect now patients to be active partners in their care. And not just active partners, but to be vocal at the level of the hospital, to be vocal in terms of how politicians now, how mental health care is administered. So people should get involved, and this is what's changing the face of psychiatry. And I think I've mentioned all the technological advances, so that's something that we should continue invest, and will demand a huge amount of effort, time, and money. And so we'll see gains down the road of that. And kind of a side issue in psychiatry that we don't talk much about, but you evoked your therapist that you thought bringing to that photo session. The role of psychotherapy, I think, has been underestimated or not valued properly in our society. It is not part of the Canadian Medical Act, so we don't cover psychotherapy in most cases. There's some that are publicly accessible, but you know, there's really limited access to psychotherapy. And it's called psychotherapy, but it acts on the biology of the brain. And And often it is the treatment that should be, that is appropriate for a specific condition, and it's not accessible. And I think our role here in psychiatry and how we deal and offer psychotherapy is essential, and that's something that we might lose or not. And here, the active participation of people like you that say, we want psychotherapy, we want the government to finance psychotherapy, will make a huge difference.
Thank you very much. Yeah. Lee, I'd like you to share, if you will, what you do today to stay on track. So you've obviously come a long way in recognizing and managing your illness and your sobriety, but what do you do now to make sure you don't backpedal?
There's so much, and if you don't mind, I wanted to touch on two things quickly.
Please do.
First, I want to thank you, because professionals in the industry make such a difference, and we don't thank them enough. And I remember being, yes. I'm also very, very fortunate because I had the most amazing upbringing, and I had every resource available to me, yet I still went down the path that I was just lost and confused for years. But I remember there was a good 4 or 5 years of my life when I was just a disaster, and my father did everything possible to try to put me on the right path. You know, therapist here, psychologist there, and I went to a psychologist here, and I lied to him the whole time. You know, it didn't help me at all, but it's because I was lying, because I thought if I fooled him. But I remember towards the end he started calling me on my BS, and I never got to thank him for that, because he doesn't realize how big of a difference he made in my life when I look back at that moment. And you know, what you were saying, talking about the family, what that triggered in me was, I am so grateful for my life today. The reason I am is because I got sober 9 years ago. Yes, you know, my life is fantastic, but it's because 9 years ago I got a second chance at life. 9 years ago I got to really have relationships. And I mean that with my family, because all of a sudden I wasn't foggy anymore. I wasn't lying, I wasn't cheating, I wasn't stealing. And the reason that's huge to me is because the one person that was my biggest cheerleader, you know, my entire life, was my father. And he was the person that always tried to put me on the right track. He wanted to make sure I was doing well. And I'm very, very fortunate that he saw me on that path of doing so well. I lost my father a year ago. And if it wasn't for the fact that I was doing okay, if it wasn't for the fact that I had my stuff together and I had a support system, if I wouldn't have killed myself 9 years ago, I probably would have killed myself last year. For me, I'm grateful because it's not just mental illness. You know, there was drugs and alcohol in my story. So I have 12-step fellowships. I have the rehab I went to. I have friends that are in sobriety. And so I have this huge support network, to the point where my sisters look at me and they're jealous. Oh, Lee's an alcoholic. That's not fair. You know, but it's true. So I have my friends. I have my family. But I did something huge for myself that I'm not ashamed to say. I would have been embarrassed 10 years ago. But I moved back to Montreal in June. And if I look at the 6 to 9 months before that, I lost my father. I just got out of a long-term relationship, and I got a huge job promotion. So I was like, maybe I should see a therapist. And I go and I tell her, I'm like, oh, you know, I'm doing good, but these are the 3 things going on in my life. She's like, Lee, these are the 3 biggest things that anyone could go through. And since that day in I think, July, I've gone every single week. And for me, having that therapist, having somebody that I could speak to on a regular basis, check in with, you know, and just genuinely say what I'm feeling without being judged, but also with someone that has no ulterior motives, has been you know, like a huge game changer for me.
Thank you for sharing that, Lee. Yeah, let's have a round of applause. We're going to do something fun here before we get to the end and get to your questions, and it's actually a poll the panel. So your answers can just simply be a number from 1 to 10, with 1 being the least or worst, and 10 being the most or best. And I will ask the questions rapid fire, and we'll go from Liz to Anthony and just keep going, okay? So the first question is, how much of an impact does stigma and shame have on those who suffer from mental illness?
I want to say 8 today. Wait, remind me. 10 is the most.
Most, yeah,
The most.
exactly.
So I want to say 5 today, but maybe 8 to 10 25 years ago when I was first diagnosed.
8.
I'm going to go with 7.
It really depends on people, but 10 on 10 in terms of how avoidable it is.
Yeah, agreed. How much, loophole. How much did the stigma stop you from seeking treatment for your mental illness?
9.
10.
10.
It really
Doesn't apply. So that's okay. You can skip that one. The next one is, how important is it for the friends and family of those struggling to be supportive?
12. Without question. Without your support system, there's no chance of healing.
Yeah.
I'm not even going to say anything. It's exactly that.
Yeah.
Just take a look at the audience.
Yeah.
On that, I would say it's extremely important. A fear that people have when they come in psychiatry is confidentiality. So we recognize the importance of support, but we'll preserve confidentiality like 10 on 10 first of all.
Yeah. How much has therapy helped you through your illness?
I was hospitalized last spring here. I was inpatient on 4 East for a week, and I had been going to therapy pretty regularly for the last 10 years or so. But we'll get to this question later, but in the last 8 months, I've been seeing a therapist who actually changed my life, and I want to give that another 12 on 10 for how much it's impacted me and how much it's put me on the journey to healing.
I'm going to say 3.33. The reason I say that is because therapy is a huge part of it, but that's not it.
Yeah.
We got to do so much more. So for me, when I'm looking at my life, that's just a portion. So it's all these things together that make the full 10. Is it important? If it's important, it's a 10.
Yeah.
But it's just the section of what I have to do.
So I actually have the same answers as Lee, but I'm giving it a 7 to 8 because for me, therapy, of course, wasn't the only thing, but I might say that it was the most important thing.
Okay, so there's 2 hopeful questions here, but is there hope for someone recently diagnosed with a mental illness?
Are we rating this again?
Yeah.
Absolutely. If I'm any example, if Lee's an example, if Ryan's an example, we are all stories of hope, of having healed, of being vocal about our mental illness, of giving it a voice. I don't even think there's a question.
Yeah.
There is a tremendous amount of hope.
It's a loaded question. I just want to hear you say it.
What she said.
Yeah.
If I have to take it down one step, 'cause that was beautiful, but I do want to say that if anybody here isn't where we currently are, that doesn't mean you're not doing the right thing. That doesn't mean you won't get there. Not that we're perfect, of course, but we are those stories of recovery that shows it is possible, but I don't want anybody to get down on themselves right now if they're not at that point where they want to be.
But also, Ryan, I want to add to that the journey is not a straight line, especially when you're dealing with mental illness, that there's always going to be ups and downs. And so that's part of what it is. And that's one of the reasons we have to start erasing the stigma. It doesn't mean that because you're doing great, that you're going to continue to do great, but hopefully you are learning the tools and techniques that are going to help you stay on the right path.
Yeah.
I think it's important to recognize that life doesn't stop when you have a mental disorder. And it's not just, okay, you have a mental disorder and then you come back to normality. In the process of recovery, I think you gain something. It's important to recognize that that becomes part of you. I think a strength, something you found, in terms of meaning, and this is part of the recovery process as well.
Exactly. It's, I used to be here, then here, then here, then here, and I don't want to be like this. I don't want to be, it's just finding that balance of how to feel all the emotions and go through everything, and it's a process.
I couldn't agree more, and I always describe it to people. I've had people say to me, you're doing well, you're on treatment, so do you ever miss the hypomania? Do you ever, because that's the whole thing that if you think about, and I always say to people, of course hypomania is a little bit nicer to go through than severe depression, because at least you have some energy to work with, but no, I don't miss it, because it was it was driving me, and those ups and downs that we all experience every day that are part of being human, suddenly they were, it was the illness, not me. And I agree with you. You don't want a flat, dull existence, and I don't have that. I still feel excitement, you get nervous for something like this. You feel like a normal person. It's just that you're not being driven or run by your illness. So I have to respect the time, and I want to make sure, so we are going to skip a few questions, but I would like to do this. Before we go to the questions from the audience, I would like you all to take, I call it a 30-second rant, but don't worry, I won't time you. And instead of asking you the question that I had prepared, I'm simply going to say, use your 30-second rant to give any message you want to give to close out before we go to questions. Starting with Liz.
Okay, so I had a whole answer prepared to this question, but I'm changing it now. Yeah. Because I have a similar story to yours with your Get Well card. And that was last summer I had hip surgery. And when I got home from the hospital, I had a kitchen full of flowers. I had flowers on every surface of my kitchen, of my living room, and I felt very supported and very loved. And then when I got out of the psychiatric unit last April, I got home and I did not have any flowers, and I did not have any Get Well cards, and I didn't have any messages. I mean, aside from the people who are closest to me, people were afraid to talk to me about it. They were afraid to wish me well. And like Jason, I felt this fury, this anger. Why did my hip surgery, who really cares about my hip surgery, get so much attention and support, but my inpatient psychiatric experience, after having been admitted here because I was suicidal, wasn't acknowledged, and I didn't feel that support. So that's my rant, is that people who are undergoing some kind of mental health crisis need your support just as much as they would if they had open heart surgery or hip surgery or anything else. That's my rant.
All right. So you look at somebody like me, I'm over the top, I'm out there, I have tons of energy, and I love myself. That's my rant. No, I'm kidding. It didn't start like that, right? I worked 9 years to get to this place today. It started with little things. It started with liking myself, talking about the things I'm going through. But when I think about the stigma, and I think about everything that I had to go through, my father, who was always my biggest cheerleader, like I said, I went to rehab, and every Tuesday there was a family group that the loved ones got to go to. And he walked into the first day, and he said to the counselor, "When's my son going to be better?" He was a lawyer. He needed facts, right? Don't talk to me about this emotional stuff. I need a fact. How's he going to get better? When's it going to be? And then he quickly realized there was no answer to that. It was going to be some time. But then you fast forward, because that was in the summer, you fast forward to Christmas, and my father handed that counselor a card. And in it said, "Thank you for being the dad to Lee in ways that I couldn't be." And it's because he grew just as much as I did. So it's not just about me changing and me having to acknowledge things. I use my support system. When I see that it's okay for me to say I can't do something on my own, but I know for sure that together we could do a lot more.
Thank you, Lee.
So doing the advocacy work that I've done, I've received so many questions about mental health, mental illness, and recovery. And most of these questions I can't answer, and I would have to yield to someone like Anthony. And what I've realized is that it's because there's so many barriers just to get better. Let's start at barrier number one. Mm-hmm. Do you have the knowledge to diagnose yourself with a mental illness, or realizing that you need to go to a doctor? Do you realize that maybe this is depression, maybe this is anxiety, this is bipolar? You surpass barrier one. You now know. Barrier two, do you feel comfortable enough with yourself to surpass the stigma to get help? Maybe you can't. If you can, all right, barrier three, do you have the financial means to go see a therapist? If not, are you able to wait 3 to 4 weeks to go see a therapist at your university or your local, CLSC? Okay, maybe you got that lucky. Let's go to barrier number four. Do you meet the right therapist? I don't know, maybe you need to shop around, but wait, it just took so long to find a therapist, now you go find another one. All right, let's say you get the right therapist. Do you have the right support group? Are you able to go to the gym? Are you able to exercise? There are so many barriers when it comes to getting better. We need to start tackling every single barrier. And that's why getting better is so hard, because there are so many barriers we need to get through. But we are going to get through them.
Couldn't agree more. Thank you, Ryan.
Yeah, final rant. I agree with everything that's been said. Maybe finish with facts, actually. So just depression. It's 3,050,000 people across the world that suffer from depression. It's becoming the #1 cause of disability. So, and that's an immense suffering, and it is very real and sometimes not visible, and because of stigma, it is kept silent, it is judged negatively, and instead it should be openly discussed, and it should be understood. So the resource we allocate as a society should simply be proportional to that amount of suffering, period.
Thank you. Thank you. Many of you have already handed in questions. I know some are, it's okay. I'm going to start with the ones I have, and I'll get to them. I promise you. So this is a question, and if a question is directed to a specific panelist, I'll mention that, but otherwise all of you can answer it. This one's for all of you. Do you find yourself sometimes faking wellness when you are in a down episode?
I'll jump on that one because the quick answer is no, but the truth is because of what I do for a living, I have to sometimes. You know, I'm on the radio every single morning. First of all, mental illness or not, you wake up at 3 a.m. every day, you're not always going to be in a great mood. but the truth is, I got to go in there, and if something's really bothering me, I'll talk about things openly on the radio. But you also want to tune into a fun, happy radio show, not Lee crying 3 days a week. So, it's not that I mask it, but for those 3.5 hours that I'm on air, I kind of push my personal life aside, and I'm there for business, there for work. But in my personal life, if there's anything bothering me, you could tell right away, but I openly talk about it with anybody. Sorry.
Yeah, I mean, for me personally, it's definitely less than when I first started. But I mean, I feel like I've kind of become this face for recovery, at least in the Montreal community. And sometimes when people hear my story, they feel hope. And I don't want to be that person who says, having a bad day doesn't get all better. But I also want to be that person who lets them know part of recovery is having those bad days and recognizing it and managing it and realizing that you now have the tools in place to handle it. Yeah. But as I mentioned previously, sometimes I still do say going to the doctor instead of the therapist. So still some room to grow, always room to grow.
Liz?
Basically what Ryan said, that the journey is not linear and that there are good days and bad days. I'm definitely better now at owning my bad days and saying to my best friends and my family, I'm not feeling good and I need your support. And I think that's the most important thing that I've learned is asking for the help I need. You can't expect the people around you to read your mind. So if you're feeling badly and you're feeling like you need the support and you're feeling like you need someone to cook you a meal or to do your carpool or whatever it is, then you need to ask for it.
Great point. And since Anthony can't answer this question, it doesn't really apply, I'll quickly answer. I just wanted to add this. Yes, sometimes I am forced to fake wellness a little bit, but here's the way that I apply it now. I think of it in those terms of, well, what if it was my heart? What if it was cancer? What if it was something else? You don't always want to talk about your illness. It's not always appropriate to talk about your illness. It's not that you are hiding it or feeling shame or stigma about it. It's just that person doesn't need to know right now. And so the people in my life who are my caregivers, my support, my wife and friends, my close friends, they all know if I'm struggling, if I continue to go through mild depressions once in a while, and they'll know about that. But if you don't need to know, then I'm not going to force it on you. So that's my attitude about it. I just thought I'd share that. This question here is, again, for anyone who wants to answer. As a caregiver, what can I do to help an individual who's suffering from mental illness to get the help they need and to get a better life and full life? So this is a very common challenge. You're someone who does not suffer from mental illness. You have someone in your life who clearly is suffering from anxiety or depression. What can you do as a caregiver?
I'm going to say patience is key, that you might approach your loved one and say, I think it might be a good idea to get into therapy, and they might refuse. But you persevere and you keep insisting because one day they'll say yes. So to me, patience is key and not giving up right away. People who are struggling or in mental health crisis sometimes the idea of mobilizing to do anything about it is so exhausting that you can't even imagine it. So being patient and persevering and supporting them.
Yeah, I agree.
Yeah, I'll just add, letting them know that you're there to offer support whenever need be. That means a lot. And it's careful to understand that that doesn't always mean that they're going to take you up on that support. And that is not something to be upset about if you offer your support and then you have it turned down. But there might be a day, a week from then, or a month from then, or maybe a year from then when that person says, I remember that person's in my corner, and now I'm ready to reach out. So, but they won't be able to do that unless they know that they're in your corner.
One of the favorite things that I learned being in a 12-step fellowship and being sober and in recovery is that, I often get that exact question, but specifically for addiction and alcoholism. And the answer that I give is you just got to take care of yourself, because there's nothing necessarily you can do right away. You got to be open, you got to be there to support. But what I love is that there's 12-step fellowships for the person that's struggling with it, but there's also support systems in a thing called Al-Anon, which is a support system just for the people going through with their loved ones, right? It's for the parents, it's for the siblings, it's for the friends. And that's so important because we all need the support together. And I'm the one that went through it. I might not be able to tell you how to do it. Speak to my parents. Speak to my friends, right? They're the ones that are going through what you are. But just knowing that there's support for everybody is really important.
I don't have much to add. I think it depends at which stage of the illness the other is. So if it's a very early stage, I think the best thing that could be done is to encourage that person to go to the hospital, go see a therapist, try to work all the resistance that this person might have. If they're ill, they might have already, they might be hopeless about getting help, and that's actually a symptom of depression, or they might be too anxious, and that's a part of their anxiety disorder. So understanding also that this is part of the whole picture and helping them through that process.
Thank you. This next question is, other than a therapist or psychiatrist, which healthcare practitioner had the best influence on your recovery? I'll start. So for me, my GP is part of my team, is part of my healthcare team. I'm so lucky. I found a GP here in Montreal when I first moved here in 2001. Somebody I knew said, hey, you should go to this doctor. He's young and he's taking patients, and he's been my doctor ever since. And it has been so helpful that he's my first step. If I think back when I first was feeling anything, I went to him first. And he was the one that helped me to, I guess, verify that maybe you do need further care. And today, if I have a recurrence of a mild depressive episode, he's the guy that I go to first. I don't just go straight to the psychiatrist, because he's a part of that team. So for me, I would add him. I think that a GP can be very valuable.
For me, it was my therapist.
Yeah.
For me, it was actually reaching out to people that I knew had gone through similar things. So it wasn't a professional, but it was having that connection with somebody that I knew struggled with the exact same stuff. That's the first person I reached out for help to.
I don't know if this counts as a healthcare practitioner, but definitely yoga. Adopting a regular yoga practice and just learning to breathe and learning to connect movement to breath and learning to meditate a little bit has really been an essential component of my mental health.
And mindfulness, yeah, as you mentioned, I did yoga and mindfulness. Two did it together.
And actually, that just reminded me something that I didn't share during my keynote that I think might be useful to you, is that if you're dealing with somebody who's struggling with a mood disorder, whether it's anxiety, depression, or bipolar, one of the key things that helped me to own my own illness and be that more active participant in my recovery was I actually started using mood and life charts. And so the way I described to you how there's a baseline and then there's mild, moderate, severe depression is on the low side, mild, moderate, severe mania is on the high side, I would actually start to track and graph out my mood. I did it backwards from when I was diagnosed in 2005, I worked backwards to 2002, and I've continued to do it to this day. And the reason for me it really helps is because it's hard data. If you, and you don't record bad days. You don't record My father passed away. That's going to be a real bad period of time in your life. It's a huge challenge. What I record is when I have a pervasive change in mood that I can't justify or explain in any way to life. And I find that helps me track when I may be entering a depressive episode, etc. And I also tracked my sleep to see, because we all have a baseline of sleep that we like to get. Some of us get none. Some of us get 7. Some of us get 10. But here's the key: if you normally get 8 hours of sleep and you suddenly are getting 10 or 12 for 2 months, or you're getting 5 for 2 months, that's a significant change in your wellness, and it's something to watch out for. So that's not really a therapist, but that was other therapists suggested that activity to me, and it made a lot of a difference for that. So I have a difficult question. It says for Well Montreal, but the reason it's difficult is because, frankly, people, there really isn't a simple answer, and we know this. Not everybody can afford a therapist. What can a poor person do? Please don't say go to a community mental health program.
Unfortunately, WELLMTL is in its extremely beginning phases, but in an ideal world, one day becomes a one-stop shop for all your mental health requirements. We want to get into schools to work on preventative measures, but obviously not every mental illness is preventative. A lot of it is treatment-based. So what we want to do is eventually we want to team up with psychotherapists and have WELLMTL, either subsidize parts of that and charge subsidized rates. There's also slide and scales options out there where, depending on your financial needs, you can receive a reduced rate for your mental health needs. And in the most ideal world, we have the government step in and add that to Medicare, as it should be. Until then, unfortunately, WELLMTL is not in the place not yet, hopefully one day. But as I mentioned, that's just one of the barriers that we need to overcome. There's so many of them. Unfortunately, the accessibility to professional mental health care is just not there yet. But it's one of those things where we need to be patient, because it is coming. Did you want to add in there? Okay. So yeah, that's WELLMTL's official statement on that.
Well done, Ryan. Very well done. Thank you. Look, there's a few things that we have immediate control over, and there's things that are bigger. They're more systemic problems. But if we continue the discussion, we absolutely will continue to see our government representing us in that discussion, and hopefully changing policies and increasing funding. We're going to have to make this the last question. There's a few of you who've asked questions that I wasn't able to get to. Some of them were answered anyway, just in the way the answers worked out. But I want to respect everybody's time. So the last question is for all of you. And this is another tough one, and I'll start off. How can you get your spouse to understand when they carry a lot of stigma? So how the heck am I going to answer that when I've had 2 spouses, neither of whom had any stigma towards mental illness? I am very aware of how lucky I've been. I'm very aware that had Lisa not understood, things would have been so much worse. When I met Anna, some of you may find this a little wild, but it was our second date that I decided to tell her, by the way, I have bipolar disorder and I don't want kids. Because we had a really good first date, and I was like, this is clearly a relationship that may go somewhere, and she's 30 years old. I don't want to waste her time. If she's really afraid of mental illness and if she really wants a kid, then it's not going to work. So thank God she was okay with both of those things. But the reality is this. If a spouse has stigma towards mental illness, it all comes back to the same thing that I started with, which is stigma only exists. I agree with Ryan. People aren't out there to be mean or cruel. We're innately good. They have a stigma because they don't understand or because they're afraid. It's those two things. It's always those two things. So find a way to speak to the fear, find a way to speak to the lack of understanding, increase their knowledge and their understanding of what the illness is and why they shouldn't have stigma towards it. That's the first step. But the reality is stigma is deep. Our society has essentially trained us to have a negative outlook towards mental illness. So overcoming that is not easy. So be patient and be consistent. And I think that's the first answer. Anyone?
I would agree with that. I think my hospitalization was my rock bottom, and it's the first time I've actually spoken about it and not cried. And I realize now that I was crying so much about that story because when I got out of that hospital, I realized that I had been letting my mental illness control me, control the decisions I made, control the paths I took in my life. And when I got out of the hospital, I said, excuse my language, fuck that. I am done with that. And I'm moving on, and I'm going to own it. And I think that was the point where my husband, who's sitting in the front row and who never, ever did anything but support me, also came face to face with my mental illness and owned it as well. I don't want to make you cry. And I think for him it was education and sensitization and listening to talks like this and perseverance that really opened his mind and let him really embrace me for all of my issues, and really understand what it was to live with someone with mental illness and to really support someone with mental illness. So I wasn't hearing anymore, well, why don't you just go to an exercise class? Or why don't you just think about all the good things in your life? I think at that point he learned that those weren't the right things to say, and the right thing to do was just be there and validate and support.
Very well said.
And since Liz broke the barrier, for those who didn't put it together yet, the sign said, fuck the stigma.
Oh.
Now I get it.
Well, in my imaginary world where I have a wife, she's stigma-free. So I will vary this question up slightly and say when I go into schools and talk to the kids, one of the strategies about anti-stigma is dialogue. How do you respond? And the trick is to validate, don't negate. Don't say to toughen it up. Don't say you need thicker skin. Don't say I know how to fix you. Try this essential oil. Don't negate what they're feeling. Don't minimize what they're feeling. All you need to do is validate. Sometimes there is no right thing to say. You're just going to say, I'm there for you. I'm here to support. You know, I can't imagine how tough this might be because I truly can't imagine. Every mental illness is unique. The only way you can begin to understand is through listening and just offering your acceptance and compassion.
Well said. Thank you.
So in sobriety, on the other side of most of my troubles, I dated a therapist for 3 years. Yeah. And you know what? In theory, it's easy to say that we don't have stigma. It's easy to say that, I understand and I'll be there a certain way. She didn't get it. She just didn't get it. And that was the struggle for 3 years of the back and forth is we both know what to say, but what are our actions? And so what I had to learn was that all I could do is take care of my side of the street. So instead of approaching a conversation by saying, you, I have to flip it around and just talk about me and my feelings, my emotions, because that's the only truth that I know, is the things that are going on inside here. Otherwise, I'm doing her thinking. And I'm trying to be one step ahead of her. Well, if I say this, she's going to say that, and then I can come back and say this. Then all of a sudden, I'm having an argument with myself in the shower. But the truth is just, Lee, calm down. What am I feeling right now, and how can I convey that properly to my partner?
Fantastic. Thank you. Before I give the mic to Ryan to say a few concluding remarks and finish the evening, I just want to say thank you all for coming. Thank you for your attention. Thank you for your thoughtful questions. You've been an amazing audience. And I want to say thank you to our incredible panelists. They brought so much to the evening. Thank you very, very much.
All right, I'm going to keep this super short and let everyone go. So one small little thing I wanted to say is the hashtags for Bell Let's Talk Day are fantastic. Bell Let's Talk Day changed Lee's and I's life, but that's not where it ends. We need to have more engaging nights like this where we engage in dialogue. We need to keep talking. We need to be there for other people, and the change starts with every person in this room. You guys are the ones who took the time out of your day to come here and educate yourselves, and that's where change starts. I just want to give a few thank yous. Jason, we went through maybe 20 to 3 keynote potentials, and I couldn't be happier that we chose you because you were absolutely fantastic. Our panel, Anthony, Lee, Liz, you guys were absolutely fantastic, and it's great that we had this diverse panel that all have different experiences with mental illness so we can understand everyone's story differently. The Mindstrong committee of Larry, Nancy, Mary, Chintzia, Caroline. This event couldn't be done without you guys, and your support was absolutely fantastic. To our sponsors of BMO Wealth Management and the best toy store in Montreal, Golt's Toys, thank you so much. And lastly, and most importantly, every single person in this room, the change starts with you guys, and I need to thank you so much for coming tonight. If I forgot anybody, I'm sorry.
We actually just have one more comment. Hold on. Thank you.
Hello, everybody. My name is Eddie Wiltzer, and I'm the chairman of the Foundation of Jewish General Hospital. And I just want to thank everybody here for enlightening us of what's going on in the world with mental illness, and we know it very well. Our hospital is undergoing right now, we are building a new day hospital for mental illness. It's actually being constructed right now. We're also at this point demolishing the third floor where all the operating rooms were, and we are building a beautiful new psychiatric ward that we really need, because the one we have right now is like a third world country, and we are going to have the nicest ward. And again, the stigma is not there anymore. It is an illness like any other illness. So God bless you all for coming, and hopefully you'll all support us in everything that we do. Thank you.